at desk job without any exercise, not maintaining any diet, will eventually end up in this. And this is a very bad killer combination to have, not only for the knees, but also mainly for the cardiovascular health. So central obesity, glucose intolerance with insulin resistance, dyslipidemia and hypertension, a killer combination to have, and association with OA is very much high. So if you see the bottom chart, the bottom part of the flow chart there, that is what we all explain to our patients. You have higher weight, you develop more loading of the knee, more degeneration and more cartilage damage. But the interesting part is when we talk about nutraceuticals or we talk about nutrition, we have to focus on the upper part of the flow chart, where you can see that obesity actually increases a very important hormone called as adipokine, leptin hormone, which is an adipokine. And this basically is predominantly in the central obesity part, in the abdominal fat, in any areas where there is increased fat deposition, this production of this hormone is more. And what it does is, contrary to the belief that we have inflammatory and degenerative joint diseases, but now it's a time for us to understand that degenerative diseases also have some amount of inflammatory part. So this adipokine is a pro-inflammatory hormone, so it causes stimulation of all the pro-inflammatory cytokines, and this also adds on to the degenerative part, the weight-bearing part also adds on to it and leads to more degeneration, more destruction of the joint, and that is what is targeted in this nutrition part of OA. So you can see this, these are the studies that have been done for weight reduction, BMI reduction in OA, and how does it actually help, whether only diet is enough or whether exercise is required or only exercise enough. So three important, two RCTs and one meta-analysis of RCTs. Actually the middle study is very interesting. With a sample size of 454, 18 months of energy restricted diet. So most of for reducing the BMI, everybody now promotes energy restriction, and an 18 months energy restricted diet, you can see that the maximum weight reduction of 11.4% BMI was in the combination of diet and exercise group as compared to either diet or exercise alone in isolation. And also this combination group had significantly lesser pain and better functional outcome than the isolated groups, and that was very significant. The meta-analysis of all the 4 RCTs suggested that disability could be significantly improved in patients with OA, and at least with more than 5% weight reduction, and that was highly suggested. And this is something that I want you to take away, that one definitely proved in the literature thing is to reduce your BMI, not only by decreased mechanical loading, but also helps in decreasing the inflammation in the degenerative joints. Apart from the obesity part, diabetes mellitus itself is known to be independently associated with osteoarthritis. We all know that diabetes leads to accumulation of the advanced glycosylation end products and the subchondral plate, and also in the chondrocytes, leading to their dysfunction and more of cartilage degeneration. A French study, longitudinal study for 3 years, suggested that it is a significant predictor for joint space joint space reduction, medial joint space reduction in men. So it is also an independent risk factor apart from the metabolic syndromes. This is something that we have to know, and again, it's overlap with the previous talk. Again, it's too much of biochemistry, but simple for us to understand when we tell our patients, MUFAs are good. Monounsaturated fatty acids are good. Polyunsaturated fatty acids are of 2 types, omega-6 and omega-3. Omega-3, whatever comes down through the omega-3 pathway is good. Whatever through omega-6 is not that great. So omega-6 leads to arachidonic acid, and that leads to all pro-inflammatory cytokines, and these are harmful for the joint, whereas omega-3 leads to 2 important components, EPA and DHA, which both are nutritional supplements. EPA is eicosapentaenoic acid and DHA is docosahexaenoic acid. Both are now being marketed as supplements. These are anti-inflammatory. So for our purpose, I think those 2 parts are enough. Omega-3 is good. And important thing is fish oils have a lot of omega-3. So people are marketing fish oils as supplements because they have more, and they can be anti-inflammatory. With the anti-inflammatory property, they can be good for the joint. But what are the evidences? What are the studies? What do the studies say? And as previously quoted, most of these evidence is coming from animal studies. Animal studies have shown that they are good for the joint. But when it comes to human studies, a systematic review, meta-analysis of 5 studies concluded that at present there was no significant, statistically significant effect of marine oil supplements for osteoarthritis, and high-level evidence is still lacking, and we need more studies to start implementing this as a routine. So from this, we go on to total cholesterol. Again, something that is very worrisome for all of us. Cholesterol is something that we link to cardiovascular health, but also it is an independent risk factor for developing OA, and this has been shown in many studies. They say that anything more than 240 milligram per DL is independently associated with the risk of developing OA. And how? If somebody asks you, you should be able to know that this is again linked to that omega-6 pathway, which leads to more formation of arachidonic acid and more inflammation, pro-inflammatory cytokines causing joint degeneration. So cholesterol lowering strategies, I think we all know about this. Just to brief it up, dietary changes, as we said, energy restriction itself can lead to a lot of reduction in LDA up to 35%. Fiber-rich diet with many beta-glucans like oats is very effective, and tree nuts such as almonds, walnuts, and pistachios in the diet also are effective in reducing total cholesterol. Coming to antioxidants, we all know everything everything that is described now. All the diseases have a basis for free radicals. More of them are for most of these are associated with free oxygen radicals causing tissue damage. So here you can see among the vitamins, vitamin A, C, and E are most commonly used as supplements, citing their additional free antioxidant effects, mainly vitamin C. But however, again, the evidence when it comes to human studies, clinical trials testing the efficacy of above are weak. There's no high-level studies available and no convincing evidence at present. Vitamin D, does it help in OA knee? No, we always tell it is good for your bones and osteoporotic. Yes, we always give vitamin D, calcium for all these patients. But again, the theory behind this, they say it helps to improve muscle power. It helps in tackling muscle wasting in OA. I don't know for how far it is true. A recent study of 413 participants by Zeng et al. Suggested that sufficient amount of vitamin D maintaining in the maintenance is required for preventing cartilage loss, effusion that is associated with OA, and improving physical function in the patients. Vitamin K, no significant, as of now, at present, no significant evidence to tell that this is very beneficial to be taken as supplement in the diet. So coming to the take-home message, so the whole idea of this talk is any risk-free means of reducing the development or progression of or relieving the debilitating symptoms of osteoarthritis should be given a try, and this is what all the companies are going to market in the coming, in the near future. At present, the strongest evidence-based recommendation is for dietary modification to reduce the weight. When a patient comes to you for the first time, tell at least reduce your weight by 10%, and this will have a phenomenal dramatic effect on your pain and your function. And also, along with that, do some low intensity physical exercise. Though the evidence for benefit of using lipid modification, PUFAs, omega-3 fatty acids, total cholesterol, using vitamins and micronutrients as supplements, again, the current evidence is sparse, and the recommendation proposed will at least, the whole idea is it will have a combination effect on your metabolic health and your cardiovascular health as well. So I thank everybody for the opportunity, and let's all stick on to this mantra of eating less and being more fit, not only for cardiovascular health, but also for the knee health. Thank you.
Thank you, Dr. Terence. Great talk. I have one question. Yeah, so we all know that, say, 20% of our post-op TKR patients are unhappy. Whatever the reason, pain, swelling, stiffness, could this, in a way, related to your talk? I mean, how does it correlate with dyslipidemia and increased BMI or diabetes? How does it correlate?
So, there are a lot of things to be, the post-TKR pain it's like a multimodal thing to be analyzed. The first thing what everybody would think is, apart from if you're using the same analgesic cover for all the patients, the primary pain perception of a patient could be different. Some people might be more pain sensitive, some people might tolerate a little bit more pain. So that aspect is a completely different thing. But apart from that, this inflammatory cascade, what was being highlighted, which still has a lot of analysis to be done, that also might be responsible, but that is not, at present, it has not been validated to know. But I mean, in future, probably things might come up.
Yes. Yeah. Any questions from the floor?
Yeah. So, Dr. Terence, I have 2 points to make. My name is Dr. Sundaram. I'm a consultant rheumatologist from Coimbatore.
Hi, sir.
See, we always get asked by patients, what should we eat? So, the only diet which has been proven to reduce inflammation till date is something called the Mediterranean style diet, which is basically a moderate amount of fish, a moderate amount of legumes and nuts, a diet which has more of unsaturated fatty acids, less of saturated fats, less calories. So I think that is the only style of food, the Mediterranean style food. Second point, regarding obesity and OA, there is a drug called semaglutide, which was initially approved for diabetes, and as a byproduct they found that it causes significant weight loss, and then people also found that it improved non-alcoholic fatty liver disease, which is also a metabolic complication of the liver. And recently there has been a study on OA where, independent of the effect on weight loss, this drug has been shown to improve outcomes in osteoarthritis also. So maybe, like you said, maybe there is an effect on gut microbiome also through this drug, which actually acts on the gut only.
Right.
It improves, liver metabolism, it improves gut microbiota, and there it has some effect on fat also because it causes weight loss and thereby reduce leptins and everything. And the researchers who have done this study have also shown
Doctor.
that GLP-1 is there in the knee also. So,
Right.
So I
Yeah,
just
thank you,
wanted
Doctor. Point taken. We'll move on to the next talk
Thank
for
you.
want of time.
Can we have Dr. Tara Jayashree? She'll be giving the Ayurvedic approach.
So I think this is my second session. The first session, முன்னாடி slide தான் first session. The previous. So pranamams to all the dignitaries and the delegates here. It brings me an immense pleasure to be a part of this symposium, and special thanks to Dr. Santosh also to include me in the sessions of great ideologies what I got from the orthopedicians around India. So I have made a small attempt to explain the potential benefits of Ayurveda, how it can treat OA, and what all the modalities and explorations what we can do through the science of our ancient tradition. So that's why I have kept my topic as uncover the Ayurvedic approaches to osteoarthritic knees. So I think I would meet your interest in justifying my topic, and what all the evidence-based therapies and possibilities we can do through this oil applications. So let me start with a question. Anyone still have an habit of applying oil to the body on a routine basis or a monthly basis or at least once a year? Is there anyone? Yeah, I can see hardly 1 or 2 hands. So I bet you with our routine, with our natural lifestyle, we have forgotten this system of applying oil and getting to explore the potential benefits of these medicated oils. So I just made a very small attempt in proving how these therapies, these forgotten therapies, can help you to make your lifestyle bit more better than what you are or what you are suffering with OA knees right now. So just my contents will be about the disease which everyone has very good knowledge, but I am just trying to give you an insight how Ayurveda looks into the knee and how it can be a benefits to the knee therapies. So from an Ayurvedic point of view, we call the joint as Sandhi, that is the place where the union of the two bones. And Vata, Pitta and Kapha are the 3 principles what we treat with, in which the osteoarthritic knees will be more where the Vata dosha gets vitiated. So the symptoms of OA in the Sanskrit terminology is Hanti Sandhi, that is the loss of the functions, and there is a pain, crepitus sound, and the sounds which just resemble the sounds of the balloon, and swelling and painful movement of the joints. So as we insist more on Sanskrit, I have just tried to correlate the terminologies with the Sanskrit also. So on examination, we all know there would be tenderness, crepitus in the movement, restricted in the rotatory movements, and fixed deformities in the higher grades, and weak muscles. Of course, the supporting muscles would be weak. So as we have a pathology in the Western medicine, we equally have pathology in Ayurveda, like Nidana Sevana. Nidana Sevana is the term where we don't follow the etiological factors which can increase the osteoarthritic changes in the knee. So once when we do or unfollow the causative factors of these, it increases the Vata proportion in the body, which can impair the circulations, and it can deform the knees. Along with that, which can cause to the Janu Sandhikata Vadam, which is nothing but osteoarthritis knees. So basically the treatment goals would be relieving the pain and the other symptoms, minimize the disability of the patients, and also minimize the risk of any other therapies. So we do get not the acute cases, we are good in treating the chronic cases or the cases where all the therapies have failed. So we just focus more on a symptomatic relief of the patients through the science-backed Ayurveda. So this coming to the causative factors, according to Ayurveda, the causative factors are excess physical therapies, and there could be any injury to the joint and injury to the vital points of the joint, and Ati Sevana, that is an excess intake of Kashaya Rasa, that is astringent taste, bitter taste, pungent taste, dry food, very cold food, and very little food. So these are the primary causative agents of this Sandhikata Vadam. And of course the old age, the degeneration causes, which tends to increase the Vata proportion in the body. Where there is an excess dryness created in the body, the Kapha proportion, the lubrication or the water element in the body obviously dries down. So that is where there is a dryness created in the joint. So our treatment principles basically lies on the conservative treatments, Panchakarma, oral medications, and lifestyle advices and diet advice. So the first treatment would be, I'd like to highlight, is the massage. So the massage is mainly done with some lot of medicated oil, in which we commonly come across Mahanarayana Thailam, Karpuradi Thailam. I can often see many orthopedicians prescribing Mahanarayana, we get it off counter, Mahanarayani gel, ortho herb and all, which consists of lot of the herbal preparations which are detailed explained in Ayurveda. And when there is a degeneration caused along with the atrophy, we prefer ashwagandha. That is like, it's a very good adaptogenic. So the oil is prepared with ashwagandha, Dhanvantram Thailam, Masha Thailam. Masham is nothing but the black gram. So that is tend to be said to be a very good like alleviator of the pain, and it can really increase the bulkicity of the or muscle strength. So all oils made with the black gram can really help in getting the degenerative osteoarthritis under control. So the first treatment modality is the lepam. Lepam is nothing but the paste applied over on the affected joint. So we have plenty of lepams like Grihadumadi, Kottam Chukadi, Nagaradi. Nagaradi is nothing but the lepam made with ginger. As we have seen many doctors explaining about the ginger and its anti-inflammatory, we have specific lepam which is done only using the ginger, boiled with certain anupanas or proportions like milk, rice wash water, and we do it according to the conditions. Where there is a swelling, we give along with the rice washed water, and when we feel that there is a need of an increased regeneration, we just give it along with the milk also. So these type of lepams really helps to reduce the swelling and the tenderness of the joints. So Januvasti, this is the second therapy, like we pull the affected portion, especially Janu is nothing but the knee joint. We pull certain amount of warm oil with a small cap, and then we just stagnate the oil. So this is a very effective treatment, and it improves the blood circulation, and it can improve the tonicity of the muscle and moisturizes the skin as well. So when we just moisturize, we are reducing the vada or the rukshatvam or the dryness created in that area. So Januvasti is a very effective treatment in ONEs. Poultices. So we might have heard lot of hot fermentations. These poultices are very they have plenty of poultices made with sand, medicated leaves like nochi ilai and the arka patra like erki ilai and all. Puli, even the tamarind can be used for this poultices. There are n number of medicated leaves where we make it into a small potli. We equally add castor oil to that, and we give hot fermentations to the affected joints. So it literally improves the knee joint movement and tries to reduce the swelling around that area. And Nadi Svedam, the next therapy is the localized fermentation. So when we direct after oil applications, when we just focus more on the fermentation to that, it improves the blood circulations and also the reduce the local inflammations of the joint. And Valuka Svedam, it is nothing but a very simple technique what we can do it at home. It is a sand potli. We just warm the sand and we make it a potli and just heat your dosa tawa or a pan, and we just give a local fermentation which gives a very good effect in the swelling cases. And local pilichil, this is like pouring of warm oil on a regular stream just on the affected place. We have n number of medicated oils where we can pour the medicated oil on a continuous stream for maybe 30 to 40 minutes, which can really help to improve the joint mobility. And this is one of the very important treatment, because according to our concept, we say that Vasti, Vada is the region, our colon is the place where the Vada gets accumulated. So by directly giving the Vasti or the enema, the Vada dosha gets under good control. Agni Karma, it's a localized cauterization therapy where the local inflammations really gets better. It is just cauterizing with an Agni Shalaka and just pointing out the exact tenderness of the knees. And Siravedanam is a bloodletting therapy where we tie a tight knot around the, like just below the knee, and we let the blood, the vitiated blood to flow out to get better with the inflammation, local inflammation. Jaluka, this you might have heard a lot. The Jaluka, that's a leech therapy, leech saliva has a special chemical called hirudin, which can improve the microcirculation and can reduce the joint swelling also. So about the oral medications, the common use medications are Shallaki, Boswellia, Gugulu and Haridra, and some other therapies like Laksha Gugulu, Navaka Gugulu and all. So this was just a case report where we happened to deal with a patient of 57, which who was advised for a knee replacement, and she didn't want to undergo that. So we tried our therapy where there was a huge deliberate reduction in the swelling, and her even the limitations of the movements were very well under control. So basically, just to sum up, this is a prevention recommendation is just stick on to your diet and get into a Rasayana Sevana. Just don't go only, just don't stop your treatment only by treating ONEs. Just go into the therapy where it can prevent the other joints getting involved in that, and regular practice of oil massage and some rejuvenatory therapies like Navarakili, which is basically the Navara rice, a calcium rich rice, maintain a healthy weight and avoid long time standing and all. And just go into a light to moderate exercise, and along with that occupational therapy, occupational changes is also required. And of course, none of the Ayurveda medications finishes without doing a patya. So just stick on to a very nutritious diet. I think we have had enough sessions on the diet. So this is what I try to give my insights and the potential benefits of Ayurveda. Thank you for the opportunity.
Thank you, ma'am. Any questions?
So, ma'am, do you employ these methods or these treatments for all stages of arthritis?
No, sir, it depends. It completely depends, because, for example, that Agni Karma, what I showed you, this is only for an acute management. And some Rasayana therapy like Navarakili and all, this is like for a rejuvenatory basis. It is purely individualistic approach and it is not a common protocol for all type of patients.
So in the mild to moderate arthritis,
Yeah.
can we combine this Ayurvedic therapy with the modern medicine principles that we are using?
Definitely. We don't stop any of already existing therapies when the patient comes to us. Of course, they don't come to us in an acute phase. Only when they want to opt out surgery or any other therapies, they seek some conventional therapies like Ayurveda and all. So in that case, we find good results combining both the therapies, because this really the lifestyle advices, the dietary recommendations along with some rejuvenatory therapies really helps to improve the quality of life actually.
Thank you, madam.
So in our branch, usually most of the time we advise patients not to massage, not to apply oil, as well as we at times tell them not to do fermentation, right? Now this is in contrast to what is coming from the Ayurvedic side. That is where most of the patients, when they come to us, they already are in the habit of either having applied some form of a oil at home, or they would have massaged the knee. So how do you look at it?
Sir, actually, I am in the background of Ayurveda almost 2 decades now. So I have started my practice right from 2004. So in my clinical experience, I have not seen even a single case which has got deteriorated within oil application. So actually our principle lies with the three doshas, that is the Vata, Pitta and Kapha. And in most of these osteoarthritis cases, we seek Vata as the predominant dosha. So the quality of the Vatas is more of a Shita, that is the cold potency. So the theory and the line of the treatment should be exact opposite to the doshas which is vitiated. So since Vata has more of the Shita guna, all the therapies which has to be applied to alleviate the pain should be contraindicated to that. So based on that theory, we actually recommend some oil application, that too warm therapy, which basically increases the microcirculation of that place exactly.
Okay, but I'll qualify sir's question. I mean, what he wanted to imply was that in a certain joint like elbow joint with an injury which is swollen, and if we do a massaging, there is a risk of myositis, and that can lead to long-term complications. But in other joints like the knee or the lower back, maybe massaging or applying gels would have a better effect. Do you agree, sir?
And it
So
basically...
applying oil and then the method or the process of applying oil, these are two things.
That matters.
So one is just you apply and leave it. That's what we do for lots of gels which are available, and that's what we advise. But then the Indian mindset is you not only apply, but you keep on rubbing it.
Yeah.
When you do that process of rubbing, actually it increases the blood flow to the local area, and sometimes it is more detrimental rather than it is helping out the patient. So that's the way it has been thought about.
Just to add on, sir, there are some therapies like local pilichil and all where the pressure is too minimal, and that way it really helps. And there are different types of oil also. For a degenerative condition, we use ashwagandha as the main oil. For an inflammatory condition, we use kotanjukadi, that's a different oil. We do have the anti-inflammatory oils, and also using that, I think definitely the benefits.
Thank
you,
ma'am.
thank you, ma'am.
We'll
Thank
go
you,
to the next
sir.
session.
Yes, sir.
Yes,
Next session.
thank
Thank you, sir.
So you have new set of chairpersons?
Yes.
Yes, sir. Yes, sir. Thank you. Thank you, sir. Thank you for.